Oh, brilliant. You got your presentation. Director of Quality. She had completed her PhD in Business Administration from British Royal College. She had studied several areas of management, leadership, psychology, nutrition, project management, occupational safety and health, patient safety, comprehensive medical quality, and infection control. Writes short stories, novels, and the last novel has been published in the name of The Night Visitor, a collection of short stories in the framework of horror stories. I'm passing her the stage to deliver the speech.
First of all, welcome to you all. Welcome from Egypt. Today we are going to start about a guide of patient safety improvement. The guide is built on the following models and theories. Knowledge translation and the quality improvement. There are differences between them. We aim to achieve our goal, improve our patient outcome. Uses method and the process improve the quality, safety, and the value of healthcare at the local level. Knowledge translation, series, models, and framework move the knowledge gained from the research evidence into practice for large-scale improvement. Knowledge translation does not replace the quality improvement approaches. Rather, they are integrated to produce an approach to change for the significant situation impact on patient outcomes. Readiness and getting started. Assess organization readiness. That happens all the time. We have a good idea, change to attempt to put them into practice and often fail. When projects don't succeed, time, resources, and emotional energy are wasted as people attempt to make it work. The impact is that team members are less likely to adopt sometimes new in the future. Organizational readiness is assessed before a practice change is introduced. Organizational readiness begins with acknowledging the value and the importance of leadership and trusting in them to be ready for successful adaptation of a new practice changes. Engaging stakeholders. Identifying your stakeholders are their perspectives about your project is vital. Your stakeholders exist at the system level as well as a local practice level. They can affect or affected by the implementation of your safety. And they can certain position drawn from their value, accountability, received and losses and benefits. Engaging patient and family. Engagement accelerators improvement in many ways, especially by the helping to focus on safety issues and solutions that matter the most patients. Actions that improve safety through engagement include effective communication and the transition. Sorry,
Dr.
I
Noha, you
lose
still there?
connection. Sorry, I lose connection.
Oh, okay.
Incident management policies and practices are co-designed with the patients. Patient engagement for safety has dedicated leadership and resources, and there is transparency about safety. Enhance teamwork and communication. Patient safety experts agree that communication and teamwork skills are essential to the delivery of quality of healthcare and preventing the mitigation errors and harm. Team steps, team strategic and the tools to enhance performance and patient safety was originally developed jointly by the United States Department of Defense and Agency of Healthcare Research and Quality. The program has been adopted and adapted by the Canadian Patient Safety Institute, and the Team Steve Canadian was made available in Canada. It is a teamwork system that offers a powerful solution to improving correlation and communication with our organization. Number two, the barrier and the facilitators and defining the opportunities. Access barriers and facilitators to exchange. Once a problem are undefined, particularly to improve the opportunities, it is time to start thinking about what the implementation strategies will help overcome the specific barrier to practice change. There are tools such as COMP-B. We are going to discuss it below, that can help identify this barrier and facilitator barrier. For example, barriers for capability, opportunity, and motivation. Capabilities such as knowledge, skills, and decision-making and habits. Opportunity such as environmental context, social influences. Motivation, benefits of capability, benefits of consequences, social professional roles, identifying, optimizing, goals, intention, emotions, and reinforcement. Measures, how we measure it. It is a setting to aim for our safety, improve project state in measurable. Exactly what you hope to achieve, what will be achieved, and the baseline and the target, and in what time period it will aim to be achieved. SMART target. Think about your aim in a relation to both process measure and patient safety outcome measure. The use of quality improvement tools such as affinity diagram, fishbone, Pareto, and the process map are also invaluable in defining the opportunity for improvement. The use of run chart in the interpretation using a run chart rules will support the telling you of the data story. That are the diagrams we use. Look beyond past harm. To improve your organization's patient safety, both qualitative and quantitative information is needed to help guide delivery of safe healthcare. A holistic conceptual model is used to accomplish these problems, and a powerful approach to achieve our prescription for safety and our approach to its improvement, a framework help users move from assurance to inquiry. By shifting from relying slowly on a focus on a past cases of harm, but to include current performance, future risk, and organizational results. Identifying a change and a change idea. This section introduces components of quality improvement, such as change concepts and ideas that align with the measurement for our project and are derived from best practices. Adopting a care bundle approach means the practice change to or interventions which have been clinically proven to have the greatest impact are grouped together and implemented. This approach will result in significantly better outcome. Change ideas that align to the measurement in your project related to the specific clinical guidelines rather than tests of change that more broadly facilitate implementation of large-scale initiatives. Implementation strategies and analyzing your system. These strategies aid to overcome barriers, leveraging the facilitators and the performance, and the best practice being, often individuals cannot change their behavior aligned with the best practices. Analyzing the understanding the system by understanding the barriers, and the facilitators allow you to learn if the team members don't have capability, opportunity, or motivation such their behavior. Once identified, implementation strategy are selected to assist the individual and the organization to overcome the barrier and enhance the facilitators. The result of this direct link with the barrier and facilitators is the ability to select highly targeted and effective implementation strategy. We put them in a diagram like this: the capabilities, the opportunities, the motivation. And we put dotting on the sections we have and what we don't have, and analyze this. Contest and adaptation and the designing tests of change. Analyze adaptation. We have some questions to tell me if I am capable of adaptation or not. Question for adaptation of implementation quality. Number 1, is the adaptation planned or unplanned? Why is this adaptation being made? Is it because there is a logistic issues, or because there is a philosophical differences of people values and benefits about what we should done? What type of adaptation are being made? Change of the content or in the context? Number 4, who is making the adaptation? The implementation team, the leadership, or the point of care staff? Who will be affected by the change? Implementation team, leadership, or the point of the care staff, or patient and family? Using rapid cycle improvement, it contains what and how. The what describes the idea, practice, change, and the how describes the strategies that will be used to change people behavior. What is a clinical practice is well-established, evidence-based practice and does not need to undergo BDSA. However, for each team, it is not known which implementation strategies are the most appropriate. Therefore, BDSA should be conducted on the how, the implementation strategy, to design the tests of the change. Plan, do, study, act. For each item I have to identify what and how. Implementation quality and formalize the standards changes. Monitoring the implementation quality. Implementation quality refers to the degree to which practice change or intervention is delivered as intended. It helps us to consider issues such as whether change intervention is being used effectively, it is perceived as valuable or useful, it is reaching the intended target audience. There are 6 keys in instruction to be considered. Number 1, the dosage. How much of the intervention was delivered? How many training sessions did people attend? Fidelity, how closely the implementation adheres to the implementation strategies, core and components. How closely did the implementation follow the content? Adaptation, change made to the intervention of the content, adding, deleting, modifying the practice change. Quality of delivery. Methods of intervention delivery, implementators, enthusiasm, clarity, etc. Reach, whether the intervention is reaching the target audience, what percentage of the staff receives the training. Participating, responsiveness, attendance, and engagement. Are the target audience and participants interested in the receptives to the change? Sustainability, what is your plan? Sustainability and demonstrating the impact. Plan and sustainability. As the sustainability fit. Select implementation strategies that fit the organization mission, value, culture, and operating procedures. Once you have found the intervention that is a good fit, the next step is aligned planning. Determine the best method for integrating the intervention into the existing organizational structure. One approach is to enlist in a champion who will advocate for the practice change to management. Choose a champion who is respected by the management and understand how to navigate the policies of the organization. How we make the change. Engage for sustainability. Let those carry out the change know how it could be benefit to them. People are more likely to change behavior if they perceive that there is a personal advantage for them. Describing the advantage of the new practice clearly can increase the change and the likelihood to individuals will communicate and continue the change to their behavior. ensure opportunities and capability building, and ongoing training in the new practice change. Enlist a champion, although it is likely to be different individuals than the one described above. This champion's role is to achieve implementation engagement, encourage and support implementers in the implementation and sustainability phase, and develop the strategies to overcome roadblocks encountered during the process. Engaging patients and their families. In addition to engaging implementation, patient and family should also be engaging. Patients and families are participants who are most affected by the new change. This group must be considered the change to be beneficial in order to be willing to continue to engage and or encourage new patients and families to be involved in their core planning. Financing. Consider financial and other support. Based on what we have, include the different sustainability and the sustainability action plan. You can determine how much in-kind support and or funding the site will need to sustain the change. When considering sustainability, financial sustainability is often the first thing identified. While support and funding may be important in preceding sustainability, we would stress that it is not the only factor. Sustainability is similar to implementation with regard to funding, although some form of continued support or funding may be necessary to sustain a new change. Funding alone is not sufficient, and additional factors is needed to be addressed. Evaluate sustainability and demonstrate the impact. It is important to assess how the team will post plan and measure sustainability to demonstrate the impact. A list of questions is considered when planning for sustainability. How will you assess whether the intervention is continuing? How will you assess whether the intervention is continuing to impact in patients? How will you assess whether the original intervention continue to be delivered with high quality? What is your plan to ensure that partnership among stakeholders are maintained to support continued to use for the intervention? Plan for sustainability, spread, and scale. Once you understand the context of sustainability, including potential barriers and facilitators, the implementation team can work on defining what will be sustained and create the action plan that will address how to transition from the full implementation to the sustainability phase, and where the impact can be continued demonstrated. Thank you.
Oh, thank you very much for sharing that.
Any questions?
I thought it was very good in terms of how it highlights patient safety. In order to deliver optimum care, the quality indicators are good for achieving this. And it was good how it highlighted that. When I do have a question, if I may, when you have an action plan put in place, when something is realized, how long does it take to implement that action plan?
Excuse me, the voice for interrupting.
Oh, sorry. You know when you have
Again.
an action.
Ah.
Can you hear me now? Dr. Noah?
Yes.
Can you hear me? Yes. Excellent.
Yes,
you know
I can hear you now.
Oh, excellent. You know when you get when something happens and you have to build an action plan on top of that because of trying to respond to whatever's happened, and you think, okay, well, we've got to fix this. We've got to do something about this. How long does it take for an action plan to be implemented and carried out?
We return back to the plan, do, study, and act. It is non-end the cycle.
I can imagine. Has anyone got any more questions? Just checking the chat box. No, okay. Well, if anyone does have any more questions, then please do put them in the chat box and we'll aim to answer them later. Thank you very much for your time.